Dear Dr. Mika, thank you very much for finding time to answer some burning questions. You are the founder and CEO of Temos International, and Temos provides international healthcare accreditations. So for the ones who do not know, how does an accreditation impact patient care and safety?
Yeah. So our intention is to ensure that patients are safe in the organization they're seeking services. So this means that they experience a high quality of treatment, that the treatment is safe, and that they get the best care they can get in their situation. And this is what we also call patient-centered care, that they experience this.
Your company is based in Germany, but I know you have a very international perspective on things. So how does Temos contribute to the international healthcare system?
So our standards are not German, although we are a German-based organization. We do our research and we develop our standards based on international standards. For example, coming from the World Health Organization, WHO, or from CDC. And this is what we then put into our accreditation system in our standards. The second thing is that we also ensure that our teams always contain international experience. So this means our assessors who are doing the on-site visit are from different countries. So we have always mixed teams. The language is always English, but we bring together different cultures, different languages, and different knowledge to ensure that the word international is really reflected in the assessment.
In most cases, choosing an international accreditation is a voluntary act. How do providers, international providers, benefit from making this very important step?
Yeah. So it depends a little bit on whom you ask in the organization. So if you ask the quality director, he would say, I want support for further improvement, for quality improvement. The financial director wants to save money. So the question is, if I have to invest in accreditation, what do I get out of it financially? So we try to support also the effectiveness, efficiency of processes, for example, so that in the end there is money saving. The combination from the financial director with the medical director would be if we can reduce incidents, and malpractice would be the worst case, but there are other incidents which are costly. So then the financial director is happy and the medical director is happy, because not only in the end the patient, of course, is also benefiting from this, but that they can reduce incidents, and also then from the financial perspective it's a benefit. Wow. So these are just a few examples.
How does a regular process look like? So assuming a clinic, a hospital decides to pursue Temos, what are the major milestones, the major steps an organization has to go through?
So first we have an application. So this can be easily done via our website. We have a registration form. There are some data to be filled in. Then our customer care team at Temos headquarters would prepare a quotation and the contract. And if this is accepted, we would then start the real process. We have online accounts where each organization has an individual account, and we have some documents which have to be filled out, questionnaires, which in the same way also help to prepare. So one example is the Temos accreditation chart. Those organizations who are not familiar with our standards yet, they can use this to get familiar with it by the fact that we translated from English to English all our standards into questions. So to answer the question, do you have this, do you have that, is easier than trying to understand the standard itself and then to implement it. So this is unique in our system, that we have supporting questions to get familiar with the standards. Once the preparation is done, there's a technical review from Temos' side. So our assessors, the team who is then also doing the on-site visit, is checking all the documents, is giving feedback to the organization to do last-minute adjustments. And then there is the on-site visit by a team of 2 to 4 assessors, depending on the size, for 2 to 5 days, again, depending on the size and the program. Then we have the final report. This has to be gone through a validation review, and then our medical board decides about the final result and the approval, hopefully in a successful case, about the accreditation award. And then we have a progress report, and after 1 year we have an annual follow-up. And after 3 years the cycle starts again.
Wow. Sounds like you're really going through with your partner as hand by hand, right? So
that's our intention, yes, that's what we try to do.
Having said that, what are some common challenges your applicants go through, and how do you help them to get through that?
One is definitely language barriers. We still face the challenge that since our standards are in English and our assessment itself, the on-site visit is also in English, that depending on the country we really face more or less issues with the language. And we try to support the organizations by being available for education and training, and by the recommendation to be very careful to translate our standard from English into the local language, let's say Turkish, and then work on the Turkish translation, then translate back the answers to English and then submit. So we always recommend, if there is any misunderstanding or potential for misunderstanding, if something is not clear, to get back to us. We will respond within 48 hours to accompany the organizations to hopefully have a good outcome.
Looking ahead, Dr. Mika, what are the current trends in healthcare accreditation, and how does Temos intend to adapt to these?
I think we all talk about artificial intelligence and digitalization, so this is definitely a topic which is coming up more and more, and it is used in healthcare organizations worldwide. So we as an accreditation body definitely have to have more standards in this direction. Temos do have telemedicine standards, so during the pandemic we developed those standards, but we see that we have to do more in this direction. So this is one point, and the second point definitely is sustainability, how to reduce the environmental footprint, how to live social responsibility, what to do for staff. And this is something we already implemented in 2017 with a complete chapter on sustainability. And since then, yeah, it was a challenge in the beginning, definitely, and hospitals didn't know what to do and how to understand it. But we see that nowadays, when the world is talking about climate change and the need for more in this direction, that it's very well implemented in many organizations. So these are 2 points for the future.
Maybe a somewhat personal question. What did inspire you to found Temos, and how has the journey been?
Oh, that's a good question. I used to be a researcher in a German governmental research organization, and I had the opportunity to participate, to contribute to a project with the content to develop international quality criteria for the management of international patients worldwide. So this was a scientific funded project, and I was the project manager and I was involved. So I learned how to develop standards and how to organize this. Once this project was completed, then I was offered to do a spin-off with the project we just finished, and I had some internal family discussion about this, and then I said I will do it, and then I changed from research to business, and this is how Temos was then founded.
What a success story. Thank you very much for this personal insight. Well, zooming out, what advice would you give healthcare providers that may seek accreditation for the very first time?
They really should do careful homework. We do have different options worldwide with international accreditation bodies, and they should really write down or be aware of their needs. So what are the standards, what are the topics which are of importance to them? So for example, we are always happy if Temos is chosen if there is a focus on sustainability, or if there is a focus on international patient management. We do have a big market of medical and health tourism. So if organizations are involved in this topic, then they should seek for standards which cover also the work of the International Patient Department, the International Office, and they should seek accreditation which includes this into the standards. If there is another focus, there might be another accreditation body. So there should be careful homework. They should talk to the accreditation body. They should write down the demands, should communicate and see how is the communication. Is this satisfactorily from the communication perspective, and then choose the accreditation body because of language, the standards definitely, the cooperation, the preparation support. These are important factors. Financial, of course, factors are also important.
So a proper due diligence is critical in this process.
Absolutely, yeah, and we can only recommend. And there are organizations where in the end we say, thank you for approaching us, but I think it doesn't fit, so that's perfectly okay.
Thank you very much for your time, Dr. Mika. It was a pleasure. Thank you.